Coming up today on the UW Medicine Pulse podcast.
Husky Stadium is the place to be tonight in the Emerald.
We take a trip to the newly renovated Husky Stadium. And it's not the field or the seats or the concessions that we're interested in, but a world-class medical facility built into the base of the stadium.
And listen, the stadium is beautiful. And the sports medicine center here, located at Husky Stadium, is beautiful. But I would say, once again to you, it is clearly made better, not just by the physical presence, but by the personnel we have assembled to try to really provide the best care to every patient.
Plus, we'll hear how ultrasound is being used in sports medicine to treat conditions that even a few years ago were very difficult to detect.
Yeah, ultrasound has been huge for us. It's portable, it's quick, it's extremely powerful and accurate at looking at the soft tissues.
And we'll meet a UW Medicine researcher who's studying ways to counteract the effect of travel on athletic performance.
And that's because where I come from in New Zealand, our professional sports teams play in competitions in Australia, so they have to travel 1,200 miles back and forward.
This is the UW Medicine Pulse with Marty Reamer. Real-world stories of the discoveries being made at UW Medicine and the impact they're having on people here in the Pacific Northwest and around the world.
I have never thought of myself as an athlete per se, but about 8 years ago I was riding my bike to work and crossing an abandoned railroad track when my front tire fell into a rut in the pavement. I went flying over my handlebars, hit the ground hard, and my wrist snapped. It was a nasty break. I found out later a distal radius fracture. That's the bone that runs down the thumb side of your arm. It's a common injury in athletes, snowboarders, football players, anyone who might land hard on their hand. A little less common, it turns out, with cyclists.
Yes, here in Seattle, biking, clavicle is actually a big thing. Because when you fall off a bike, you're falling on your shoulder.
Yeah.
Because when you go snowboarding or skateboarding, you fall on your wrist first.
And even though I was unlikely to ever use my wrist to fire a 50-yard shot down the gridiron or slap a 100-mile-per-hour backhand on the grass courts of Wimbledon, I ended up at a sports medicine clinic for treatment.
You saw it on the backside there.
What was I doing at a sports medicine facility? That sounds like it's meant for a higher caliber of activity.
Oh, my goodness.
Right?
Oh, Lord.
What do you think about when you hear the term sports medicine?
I think of athletes.
I would say someone that would work with the Seahawks.
People needing their ACLs repaired.
Or someone that works with the Huskies.
That's exactly what I thought.
As you'll see, there are patients in here in a variety of different phases of rehabilitation. You may see someone...
Even up until recently, when I was granted a tour of the brand new sports medicine facility that UW Medicine built into the base of the renovated Husky Stadium.
This is a tunnel that connects the stadium center to Husky Field.
That is Stan Herring, UW Medicine physician and the director of sports, spine, and orthopedic health at UW Medicine.
Do you go to all the Husky games?
My job is more involved with being one of the team physicians for the Seahawks, but there are physicians in this clinic who provide all the Husky care.
How helpful is it that it's in such close proximity?
There's certainly the advantage for Husky athletes. The Husky team physicians practice at this location, and so for them to have access to their athletes in such an immediate fashion with such great physical facilities and all the greatest and latest technology is important in terms of maximizing the care for our Husky athletes. But we also want to emphasize that while this is a great location for Husky athletes, this is a great location for anyone in the community who wants to receive sports medicine care as well. And if they can't come here, they can come to any of our other 3 locations. So yes, it's a great place to be a Husky athlete, but it's our philosophy that there's an athlete in everybody.
Well, if there's anyone who could get me, the non-elite athlete, to feel okay about visiting a sports medicine facility, it's got to be this guy.
When patients say to us, we want you to treat us like you treat the Huskies, well, the answer is we treat the Huskies like we treat you.
When I broke my wrist, the surgeons did an admirable job of putting that complex joint back together again using a variety of screws and plates.
Yeah, so we're seeing here, did you have hardware put in you?
Yeah.
Yeah, so you see this very bright echo right here with this shadowing that's going down behind it. That's the typical appearance of metal hardware. So
At the time, treating the broken bone was the main goal. There wasn't much attention given to the soft tissue, the tendons and the ligaments.
Some of the other cool things that you can see here, for instance, if we now look at it, not in cross-section, but along the length of the tendon, you can then watch as those tendons are moving, again in real time. So
treating soft tissue injuries, which historically have been difficult to diagnose, has become a strong focus for UW Medicine physician Alfred Gellhorn, who utilizes some of the most advanced ultrasound machines being made to identify soft tissue damage.
I would say that the soft tissue injuries have historically been something that has been very frustrating for both patients and clinicians because the diagnosis is often very difficult, and they will frequently turn into chronic problems that are much more difficult to sort of get after than putting the bones back together.
Help me identify, what do you mean by soft tissue?
Soft tissue is anything that is not bone in the musculoskeletal system, and that's primarily what we deal with is tendons, which connect the bones to the muscles, ligaments, and muscles themselves.
So what role is ultrasound playing in revolutionizing the diagnoses and treatment of these soft tissue injuries?
Yeah, ultrasound has been huge for us. It's portable, it's quick, it's extremely powerful and accurate at looking at the soft tissues, and we can oftentimes do physical exam on the same day as we do an ultrasound study, so patients will come in and we'll be able to examine them and then perform an ultrasound to look at their tissues. We can see how things are moving dynamically, so opposed to most other imaging studies like MRI or X-rays, ultrasound allows us to really watch the soft tissues as they're moving. So watching the shoulder move, a lot of these pathologies are really only something you can see while the tissues are moving.
Ultrasounds have certainly been around for a while, but why are they just now coming into play to treat sports-related injuries?
Yeah, ultrasound's been around for a long time, but the technology has really started improving drastically in the last 10 years. People are probably most familiar with ultrasound in the setting of OBGYN and maternity, and it's been in use there forever. But for the musculoskeletal system, really over the last 5-10 years is when it's started to come into popularity, because the power of ultrasound has really gotten so great in that time.
And say 5 years ago, if you'd used an ultrasound on my arm, how would the image have looked different?
It would have looked extremely different. It would not have, as I'm moving, you can see how smooth this picture is. It's almost it's essentially in real time. Each pixel on the screen here is created by an enormous amount of processing power, where the sound wave has to travel into the body, hit tissue, bounce back, be analyzed by the probe, and there's tens of thousands of pixels that make up each image, all of which requires a huge amount of processing to turn that into a picture. So for one thing, pictures 5-10 years ago were extremely choppy when you'd move this, so the machine would create the image, but then as you moved it, it would have to recalculate what the image was. And that's done so quickly now that it is real time.
And how do these improved images lead to better treatment?
The precision with which we can guide therapies, so injection treatments where you are trying to place an injected therapy into a precise location right by an injured tissue. Obviously, if you're doing this just by feel, without any image guidance, you can be pretty close, but with ultrasound, you can place your needle exactly where you want to get it. And if it's a steroid injection, or if it's a regenerative treatment such as platelet-rich plasma or autologous blood or even stem cells, those things can be injected directly to the tissues that we want.
Using ultrasound as a diagnostic tool offers one other distinct advantage for patients over an MRI.
The accessibility is huge. You don't have to get into a tube like for an MRI to get this done. So, about 10% of patients have claustrophobia and can't actually get an MRI. Patients really enjoy that.
In the case of high-energy falls on your hand, like the one I and many athletes sustain, there is one ligament in particular in the hand that can get damaged that, if not diagnosed promptly, can lead to trouble later on. It's the scapholunate ligament, or commonly called the SL ligament.
It's an important injury in that it's oftentimes missed. Oftentimes x-rays are interpreted as being normal. Patients will come in, it sounds like it's a wrist sprain. They get an x-ray, there's no fracture. There's actual ligament injury that's completely missed. And it's also important that in the setting of a distal radius fracture like you had yourself, people are focused on the bony injury rather than the ligament injury. So you can have a fairly bad distal radius fracture with a scapholunate ligament that's been torn, but it's been completely missed or neglected. And so it comes back later on and it becomes a chronic injury, which becomes a lot more difficult to treat.
Jerry Wong is a UW-Medicine physician at UW-Medicine Hand, Elbow, and Shoulder Center. An injury to the SL ligament would be missed by an X-ray altogether. So again, UW-Medicine's advanced ultrasound devices come into play here.
This is a bone here. This is a bone here. This is the scaphoid bone here. This is the lunate bone here. And the space between them is the scapholunate space, or the scapholunate interval. And usually in that space, you have a ligament. And the ligament sort of prevents those two bones from spreading apart relative to each other.
Well, it's kind of a typical presentation. I sprained my wrist about 2-3 months ago. It still hurts. Especially if I try and do a push-up or try and do yoga, it's that wrist extension that really puts a lot of load on the scapholunate joint. Initially, it looks like it's completely normal, but you'll see a large gap between the scaphoid bone and the lunate bone. So normally there's a ligament that holds the two bones together. And a scapholunate ligament injury, the ligament's completely torn, so there's separation of the bones. And we're finding out more that patients coming in with a distal radius fracture, which is very, very common, is probably one of the more common bony injuries that we see. We focus on the bony injury, we miss a soft tissue injury. And there's a recent study looking at patients who have a distal radius fracture that have arthroscopy done, where we go in there and look at the joint. And as many as 25 to 30% of patients actually have a scapholunate ligament injury.
And you can see that ligament in you right here. But more importantly, what we can do with ultrasound is to have you dynamically stress that joint and see if there's any widening of this. So if I gradually have you make a fist, which will stress that space, we're looking for any spreading apart of these two bones.
Yeah.
And if you just relax and then make a fist again, you can see that there's actually no spreading of the space here. So that ligament is completely intact.
Does anything that you have going on physically prevent you from doing any of your regular activities?
My foot, because it's broken. Playing sports, playing basketball.
I used to have shin splints, but I've been pretty lucky with not being injured, so.
Well, I always have bad knees, so.
I don't run around the lake anymore because my hip's bothering me.
The idea is that it's not just the relief of pain, it's the restoration of function. And we try to match the best total rehabilitation program for every patient.
UW-Medicine's sports medicine, in addition to treating injuries, is also on the leading edge of enhancing athletic performance.
Yeah, I have an interest in recovery or performance, actually, of athletes after they travel.
Home field. You know what it's like coming in here. It's the field. It's the place.
Every team knows that their away record is always worse than their home record. And what element of travel can travel have in improving that?
Bruce Twaddle is a professor of orthopedics and sports medicine at UW-Medicine. As his accent may have indicated, he's originally from New Zealand, where because of the long distances sports teams typically have to travel, he became interested in the effects of air travel on athletic performance.
So what we found, particularly with a sport called netball, which is a sport played in New Zealand, number one female participation sport in New Zealand, only played by females, a lot of rapid change of direction involved. They have a big issue with the elite players of getting calf cramp and fatigue. And it significantly affects performance, and it's significantly affected by travel. So when they fly on a plane and they get off the plane and they have to train or compete, their perception of how the symptoms in their calves is much worse.
Flight 56, service to London Heathrow Airport.
So what is it about air travel specifically that affects these athletes?
Well, Air travel has an effect because of the barometric pressure changes, and we know that you have an increased risk of getting venous thrombosis in your leg, clots in your legs when you fly. So we always warn patients who've had surgery that if they're travelling more than 3 hours in an aeroplane, they need to do something about thinning their blood. So there's something about altitude, changes in barometric pressure, sitting in an aeroplane that increase the risk of venous congestion. And so what we've done is we started a study where there are machines we use for people to reduce the risk of clot formation while they're in hospital. The pneumatic pump systems that compress your calf in a sequential way. So there's compression, release, and it works its way up your calf. And so we trialed this in these athletes using these sequential compression devices in a mobile compact form where they could travel with them. They have a portable battery-powered system. So they wore them on the planes, they wore them after they played, and we used each player as their own control. So they'd spend 3 weeks with them on, 3 weeks with them off. And what we found was the players' perception of their symptoms and performance was significantly improved. And when we measured their calf circumference, so we had a physical measure of whether it was working or not, it made a statistically significant difference to their calf circumference. So we could measure an effect. Commercially now you have all these body compression clothing that people wear and use. No one's ever shown that they make any significant difference to the physical parameters of what you're trying to improve. But with these sequential compression devices, we showed that it made a measurable difference to their calf swelling. And that was correlated with their improvement in their symptoms. So they would wear them on the plane, get off the plane, and feel like they were fresh as a daisy.
It is our pleasure to have you on board this beautiful Sunday afternoon.
That sounds great for the athlete, but now I wonder, could this help anyone on a long flight?
So anyone traveling who has issues with venous flow, I'm sure would benefit from the system. But as you know, elite athletes and professional athletes are trying to do anything that can give them a slight edge. And so that's why they love the body armor or whatever it is they're wearing, because they feel that the compression helps. But this, I think, takes it one step further.
So what does all this mean for you? Whether you're a professional athlete looking to eke out just a sliver of advantage over your competition,
Washington Huskies,
or you're a weekend warrior with an annoying ache or pain that's holding you back, or just a guy who, while riding his bike to work, trips over some railroad tracks and cracks a bone, you can receive top-tier treatment at UW Medicine's Sports Medicine Center. In fact, it's a huge plus that we all get to benefit from the same research, the same equipment, the same staff as the elite athletes who get treated at these facilities as well. And then there's the Scapholunate, a ligament that is a scant few millimeters in length that few of us have ever heard of. And yet, there's a physician researcher at UW Medicine whose passion it is to make sure that that one piece of anatomy doesn't keep you from being as active as you want to be.
Well, I think that if you elevate the level of sports medicine care in the community, everyone benefits. Not just the athletes, but every active person benefits.
Thank you, Dr. Stan Herring, and thanks to all of our guests, Drs. Alfred Gellhorn, Bruce Twaddle, and Jerry Wong. UW Medicine Sports Medicine Center, located at Husky Stadium, is operated by UW Medical Center. To find out more about the topics discussed on today's program or to send us feedback, you can always visit our website, uwmedicine.org/pulse. And please subscribe to this podcast on iTunes to get every episode as soon as it's released. UW Medicine Pulse is produced by Tina Knoll, production assistance from Mary Robinson. I'm Marty Reamer. Thanks for listening.